Hello, my name is Daytwan Mathis. I'm about to do a head to toe assessment. I'm going to start by inspecting the patient's skin. Well, first, let me ask you for permission. Is it okay if I do a head to toe assessment on you?
Yes, sir.
All right. So I'm going to start by inspecting his skin. Just look at the general appearance. I don't see any lumps, no major bruises. I'm going to check the skin turgor for dehydration. Skin turgor is fine. Check the forehead. Skin turgor is fine. I'm going to check the hair. No issues with the hair. I'm gonna go back to the fingernails to check for capillary refill, and they are less than 2 seconds. I'm gonna look at facial symmetry. The nose is midline, eyes and lips, everything is symmetrical. Palpate the head and the scalp and the sinuses. Tell me if you feel any pain. No pain?
No.
Okay. Palpate the TMJ now and fluidity of the jaw movement. Open your mouth. Close. Open again. And close. Great. Okay. I'm gonna ask you to close your eyes. Tell me when you feel something touching your face.
No. 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 No.
Okay. You can open your eyes. I'm gonna have you raise your eyebrows, squeeze your eyes shut. I'm gonna try to open them, keep them closed. Great. Can you smile for me? Can you puff out your cheeks and try to keep them out as I'm trying to push them down? Good. All right, now go look at your neck. Look at the veins of your neck. No distended veins, so that's good. I'm gonna also take the carotid pulses. Great. Now I'm gonna assess the thyroid. Assess the thyroid. Take a drink of the water. Okay. Thank you. Make sure this is still recording. Perfect. All right, now I'm gonna check your lymph nodes. Normally, if they're swollen, it'll mean that you have an infection. So I'm gonna do the preocular first. No pain. All right. Then we're gonna move to the posterior ocular, behind the ears. Then the occipital, just roughly right here. The submental. Okay. The submandible. And then the tonsillar. The last two would be the cervical, which is right here, and then the supraclavicular. Actually, the cervical is right here at the neck, and the supraclavicular is right above the clavicular line. All right, I'm gonna assess the cranial nerve number 2. I'm gonna have you shrug your shoulders for me. All right, and I try to do it as I resist. Good. I want you to turn your head left to right for me, towards your shoulders. Now do it as I try to force your head the opposite way. Good. Great. Now I'm going to inspect and palpate the eye. I'm looking at the orbital, it's fine. The sclera is white. The conjunctiva is pink. Alright, tell me if you can read this. Well, what does it say?
Bates Rocket's Guide to Physical Examinations in History.
Perfect. That was the vision assessment of cranial nerve number 2. Number 3, I want you to follow the pen. Perfect. Okay, I'm going to get my pen back. Look straight for me. Okay. Alright, eyes did contract. Okay, I want you to follow my finger. I'm just gonna look at your pupils. Alright, pupils are getting smaller as I'm getting closer to his nose. Alright, so I want you to touch my finger to touch your nose. Perfect. Alright, I want you to stare at me and tell me which hand that's moving.
Your left.
Okay.
Your right. Both.
Perfect. Alright. Now I'm going to inspect the ears and palpate the ears. Alright, any pain?
No, sir.
If I had an otoscope, I would rest my finger on the face like this, pull the helix up and back to see the tympanic membrane. Alright. I do not have a tuning fork, but if I did, I would do the Weber test and I would put that on the frontal lobe, and the sound should be, ask them which ear they hear the sound louder in, and it should be equal. And that's for sensorineural. The Ryan's test, I would use a tuning fork as well and put it on the mastoid process behind the ear and ask them if they hear it closer or more in the bone or when it's next to the ear. And that's for the conductive hearing. All right, now we'll look at your nose. Okay. Once again, if I had an otoscope, I'll look inside, look for polyps, look for inflamed turbinates. All right, for your mouth. Lips are pink. Can you open your mouth? Go ah.
Ah.
Okay, buccal mucosa is pink. Lift up your tongue. All right. And can you pull down your bottom lip? Perfect. All right, can you stick out your tongue for me? Can you lift it up? All right, and that is for cranial nerve number 12. I'm going to test cranial nerve number 9 and 10 by asking the patient to swallow and see if there's any delay. Perfect. Also with cranial nerve number 9 and 10, I'm going to have the patient say ah.
Ah.
Same one time?
Ah.
All right. There was no deviation of the uvula from the midline. All right, for this, I'm gonna ask you to turn around and sit on the bed. Just breathe normally. So now I'm looking at respiration rate. I'm looking at the expansion of the chest wall. Make sure there's no accessory muscle use. Tell me if you feel any tenderness. No pain?
No.
Okay. As it expands evenly. Now I'm going to percuss the thoracic cavity. Okay. I'm going to place my hand on your back as I move down, which you say 99 repeatedly.
99, 99, 99, 99, 99.
Okay. As I did that, make sure to stay away from the scapulas. Now I'm going to do the whisper pectoraliquy test. This time we should do whisper 99. Okay. Actually, we're going to do that again, listening with the stethoscope. So the whisper pectoraliquy test again. Okay. Now we're going to do the bronchophony test. This time just say 99 in a normal tone.
99, 99, 99, 99, 99.
Perfect. Now we're going to do the egophony test, and I'm going to have the patient say E repeatedly. Okay, go ahead.
E repeatedly, E repeatedly, E repeatedly, E repeatedly, E repeatedly.
Okay.
Am I supposed to just say E?
Yes, just E. Now we're going to check for CVA tenderness. So here I'm going to look for the last rib and then find where the spine is and find the CVA angle. So roughly right here. Any pain?
No, sir.
Okay. Any pain?
No.
Okay. Okay, I'm gonna have you turn around. So now I'm going to palpate the precordium. Okay, somewhere right here. No lifts, no heaves. All right, so now I'm going to locate the PMI, which would be mid-clavicular line, fifth intercostal space. So roughly right here. So now we're going to list to the lung sounds. We have the aortic, which is second intercostal space on the right border. we have the pulmonic, which is the second on the left side. The tricuspid would be the fourth intercostal space on the left sternal border. And the mitral is fifth intercostal space, mid-clavicular line. Okay. So that was with the diaphragm. Now we're just the bell for the same positions. So we have the aortic, the pulmonic, the tricuspid, and the mitral. Okay. Okay, I'm gonna have you lay down on your back, head this way. Okay. Gonna auscultate those sounds once again. The aortic first, the pulmonic second, tricuspid is next, and the mitral valve last. Perfect. Okay, now I'm gonna have you lay on your left side. Now we're gonna check for mitral stenosis. It's the same position as they're laying on the lateral left. Okay, so that's good. No murmurs heard. All right, you can sit up. So now we gotta palpate the pulses. We'll do the radial first, the brachial, the popliteal, which is behind the knee, the dorsalis pedis, and then the posterior tibia. Okay, same with the other foot. Posterior tibia, dorsalis pedis, the popliteal, the radial, and then the brachial. Okay. I'll be right back. Let me go grab a pillow. now I'm going to have you lay on your back with your arms over the side. Alright, so we're going to start by looking at the abdomen. Do you mind if I raise your shirt? Okay. Alright. No signs of hernia or anything like that. We will also take all 4 quadrants. Alright, hyperactivity heard in all 4 quads. Now we're going to auscultate the aortic artery. So we're going to find the midline, and it's going to be somewhere by the diaphragm or below the diaphragm to the left. Okay, next we have the renal. Actually, the aortic is below the diaphragm midline. The renal artery is maybe 3 inches away from the aortic to the left. Then we have the iliac. Which is below the umbilicus. And the femur would be roughly right here. So now I'm going to percuss all 4 quads. Then we're going to try to find the liver. So we have the rib right here. We go percuss going upward. Okay. Can you put a finger right here? Perfect. Okay. So right here is where his liver is. It's between the 6 and the 12 centimeters. All right, so now we're gonna do some light palpation of the abdomen. Let me know if you feel any pain. Any pain?
No.
Now we're gonna do deep palpation. Any pain?
No.
Good. Now we're going to palpate the liver. Take a deep breath. Okay. Now we're going to attempt to palpate the spleen. And it is, let's see. At the point of the 10th rib cage. All right, take a deep breath. All right, there's nothing palpable there, so that's a good sign. It shouldn't be palpable. All right. Now we're going to palpate the kidneys. So we're going to find that CVA point. Okay, and do on the other side as well. How you sit up now? So now I'm going to inspect the muscles and the joints. Okay. Muscles look fine, no issues. We're gonna do range of motion of the neck. So I'm gonna have you extend upward, go down to your chest. We're going to extend the neck to the left and to the right. Okay, now we're gonna do some shoulder assessments. Grab your arm. This is gonna be the adduction. Any pain?
No.
Okay. The abduction. Okay, I'm gonna extend your arm again, and then when I release, I want you to keep your arm in the same position. Good. Now we're gonna do the internal rotation. So I want you to take your right arm, reach behind your head, and touch your scapula in the back. On the right side. So try to touch right here. Perfect. Any pain when doing that?
No.
Okay. Okay, now I want you to extend both arms, and then I want you to rotate outward. Any pain? Okay.
Nope.
All right. We're gonna touch your shoulder resistance again. Try to push up. Good. Now for your supraspinatus strength, I want you to extend both arms, the palms up, and pretend you have a can of something and you pour it in out. Any pain with doing that?
No.
Okay. We're gonna extend once again, like you were. All right, try to push up. All right, now try to push down. Good. Now we're gonna do the nearest test. You gotta take your arm and just gonna lift it up. Any pain?
No.
Okay. Now for your elbows, extend your arms. Bring it in and out. All right, that was the flexion and extension. For your wrists, we're gonna bend it in and extend out. Okay. Now we're gonna test for, we'll do the Tenille test. See your arm. Any tingling in your hand?
No.
Okay. Now the Fallon's test. I want you to take your wrist, go wrist to wrist like this, and see if you can hold it like this for at least 5 seconds. 1, 2, 3, 4, 5. Okay? No pain when doing that?
No.
Okay. For your fingers, I want you to take both of your hands, extend back, and spread them apart. Perfect. All right. Once you take both hands again, squeeze them tight. Try to lift up just your hands, and down just your hands. Good. All right. So for this test, I need you laying down again. All right. So we're testing hip movements. All right, we'll tip your leg in a 90-degree angle, bend at the knee, and push it up. Okay. Now I'm gonna bring it around here. Okay. All right, and that was the internal, external rotation, and flexion at the 90-degree angle, and adduction and abduction. I'm gonna have you sit up again. For this one, I just want you to, this is gonna be for your knees, just lift both your legs and bring it back down, okay? And for your ankles, we're gonna do, lift just your foot up, down, okay? Same over here, and down, good. Now for this next test, I need you to lay on your stomach, feet up here. This is the subtalar test. Right. Okay. Now the transverse dorsal. So this one I need you to lay your back. So we lift the leg. And this one's going to be for your toes.